Pablo is a nurse in La Paz Hospital in Madrid. He worked on the front line against COVID-19. He never imagined the toll it would take on his mental health.
For a long time I've been experiencing this inner anguish, this lack of breath that I never experienced before.
It was a year ago when hospitals were overwhelmed. There was limited personal protective equipment and doctors had to prioritize treatment to the most viable patients.
We couldn't do much more. Me as a nurse, the only thing I could do was to take care of these people in their last days, giving them the love they needed.
The applause from the balconies brought some comfort, but nothing would stop the helpless feeling of not being able to save more lives, the fears of falling ill or infecting their families, and trying to keep their loved ones away from their daily trauma.
You're fighting against the disease and they know you can get infected. And on top of that, when you get home, you can't tell them what you're going through at the hospital. You can't do that. So you have no choice than to cry on your way home from work.
Health workers on the front line have paid a great price in the fight against COVID-19. A recent survey shows 1 in 3 suffered from depression after the first wave, with half of them requiring professional mental health assessment, and 1 in 4 suffered from post-traumatic stress disorder, similar to those who have been in a war zone. In La Paz Hospital in Madrid, they knew they had to give psychological support to their staff from day one.
We learned that it's as important to take care of the patients who are sick as it is to take care of the professionals taking care of them, so that they are able to look after the sick properly.
It was only after the first wave that Pablo decided to seek help.
I didn't feel the strength to open up before, nor could I even find the time to do so.
Now he attends the weekly mindfulness sessions held at the hospital.
What we are doing most of all is connecting with our inner strength, not just with our vulnerable side that has appeared in all of us, but the strength that can come out of this vulnerability.
They will need all their strength because the pandemic is far from over, but at least for a few minutes they have time just for themselves so they can continue caring for others. Jaime Velázquez, Euronews, Madrid.